أعزائي طلبة المرحلة الأولى، السلام عليكم ورحمة الله وبركاته. اليوم محاضرتنا عن ال Medial Compartment of the Thigh. As you know from the previous lectures, the deep fascia can send septa in between the muscle. يعني الديب فاشيا إنه واحدة من وظائفها إنه تعمل حواجز in between the group of muscle. Form a septa that pass in between the muscle to form compartments حتى تقسم لنا الثاي into compartments. Here we have the medial compartment. Medial compartment, this is in the blue color. The medial compartment, as any compartment in the upper or lower limb, to contain muscle and the nerves that supply this muscle and the blood vessel that supply that compartment. What are the muscles of the medial compartment of the thigh? These muscles are gracilis, adductors muscle اللي هنا adductor longus, brevis and magnus, and the obturator externus muscle. What is the blood supply to this compartment is from profunda femoris artery, which is a branch from the femoral artery, and the obturator artery. What is the nerve supply to this compartment or the adductor compartment is through obturator nerve. First, we come to the muscle of the medial compartment. These are the most medial one is the gracilis muscle. Gracilis muscle. Gracilis معناها عضلة نحيفة. We can see that extend from the pubic bone down to be inserted to the tibia. It is the most medial one. Next, we have the adductor longus muscle. Adductor longus. Next to it is behind it is the adductor brevis, and we have the largest one is the adductor magnus muscle, which is a triangular in shape muscle. Here, the adductor magnus, near its origin, it have a hiatus in its tendon called adductor hiatus. We can see that the femoral artery and the femoral vein is passing through this hiatus. And also we have the obturator externus, which is also one of the muscle of the medial compartment of the thigh. So these are the muscle of the medial compartment. First the gracilis, adductor longus, adductor brevis, adductor magnus, which is the largest one, and the obturator externus. What is the nerve supply to this group of muscle? Is through the obturator nerve. Obturator nerve, this is a branch of the lumbar plexus. هذه هي الضفيرة القطنية lumbar plexus. This plexus of nerves is formed within the substance of psoas major muscle. يعني تتشكل في داخل هذه العضلة اللي هي السوس major. قلنا هذه العضلة it have a lateral border and it have a medial border and it have anterior surface. Psoas. Then it will unite with the iliacus to form the iliopsoas muscle that's inserted into the lesser trochanter here. From its medial border we have the emergence of the obturator nerve. Obturator nerve اللي هو will supply the adductor group or the medial compartment of the thigh. We can see from this figure that the obturator nerve is passing through the upper part of the obturator foramen. So the obturator nerve arises from the lumbar plexus and its root value is L2, 3, 4. Emerge on the medial border of the psoas muscle within the abdomen. Transforward on the lateral wall of the pelvis. This is the pelvis, هذا هو الحوض. On the lateral wall of the pelvis. Transforward on the lateral wall of the pelvis. Down to reach the upper part of the obturator foramen. where it divide into anterior and posterior division. هنا راح ينقسم عندي إلى anterior posterior division. Here this is the obturator nerve descending on the lateral wall of the pelvis. Here this is the lateral pelvic wall. It is accompanied by the obturator artery until it reaches the upper part of the obturator foramen, where it passes through the obturator canal. Here the obturator nerve and the obturator artery passing through the obturator canal to enter the medial compartment of the thigh. Here, as it passes through the obturator canal, it will divide into anterior division and posterior division. The anterior division will pass in front of this muscle, which is the obturator externus muscle. And the posterior division will pass through the obturator externus muscle, and also it will supply it. So, the obturator nerve have two divisions. The anterior division will pass in front of this muscle, and the posterior division will pass through obturator externus muscle and supplying it. The anterior division here passing in front of obturator externus, in front of adductor brevis, and behind adductor longus. This nerve also give a cutaneous branch that supply the medial side of the thigh. So we have the anterior division of obturator nerve and we have posterior division. The anterior division, here this one, it gives muscular branches to the gracilis, adductor brevis, adductor longus, and occasionally to the pectineus muscle. Articular branches to the hip joint, and also, as we said, it will supply the skin on the medial side of the thigh. All these are branches from the anterior division of the obturator nerve. The posterior division, it will pass through the obturator externus muscle. Also, it gives muscular branches to the obturator externus, to the adductor part of adductor magnus, and occasionally to the adductor brevis. The posterior division will terminate by descending through the opening in the adductor magnus اللي هي قلنا adductor hiatus to supply the knee joint. What is the blood supply of the medial compartment of the thigh? Is through, as we said, obturator artery. The obturator artery is a branch of the internal iliac artery. This is the iliac artery. This is the internal iliac artery. The obturator artery arises from the internal iliac artery, passes on the lateral side of the pelvis to reach the upper part of the obturator foramen to pass through the obturator canal with the obturator nerve. As it passes through the canal, it will divide into a medial branch and a lateral branch. It will give an articular branch to supply the knee joint. The obturator artery, it will give an articular branch. This articular branch will pass through the ligamentum teres, or the ligament of the head of femur, to supply the head of femur. Another source of blood supply to the medial compartment of the thigh is through profunda femoris artery, or it is called the deep artery of the thigh. This artery emerges from the lateral side of the femoral artery. Profunda femoris artery, or the deep artery of the thigh. As it emerges, it will give two branches: the medial circumflex femoral artery and the lateral circumflex femoral artery. Then it will continue down, give muscular branches, and it will give what we call the perforating arteries. Perforating artery. Why it is called perforating? Because it will pass through the muscle to supply the back of the thigh. This is the profunda femoris artery, or the deep femoral artery, and as it emerges, it will give the medial circumflex femoral artery and the lateral circumflex femoral artery. and then it will continue down at we will give this perforating artery, and it will end as the fourth perforating artery. Popliteal fossa. Fossa, it means a depressed area. Popliteal fossa, this is a diamond-shaped depressed area intermuscular space. يعني شنو؟ يعني في منطقة منخفضة معينية الشكل. It is situated at the back of the knee joint. Situated at the back of the knee joint. It have, like other fossa in the body, it have a boundaries. It have a roof, floor, and contents passing through. First, roof. الروف هنا الاعتيادي راح تكون يعني السطح. الروف it is formed by skin, superficial fascia, and deep fascia. If we remove the skin, superficial fascia, and the deep fascia, we will find the contents. راح تظهر عندنا ال contents. This is the roof. First, it's formed of the skin, superficial fascia, and deep fascia. Next, what are the boundaries of this diamond shape اللي هو هذا الشكل المعيني? We have a lateral boundary and a medial boundary formed by the muscle. So it is an intermuscular space. Lateral boundaries above is the biceps femoris, and below is the lateral head of gastrocnemius with the plantaris muscle. While medial boundary, from above we have semitendinous muscle, semimembranosus muscle, and below is the medial head of gastrocnemius. So this muscle will surround this diamond-shaped space that is called popliteal fossa. What is the floor؟ يعني إذا سوينا dissection, deep dissection يعني التشريح العميق، راح تظهر عندنا الفلور اللي هي الأرضية. The floor is formed by, from above downward, this is the popliteal surface of the femur, the posterior ligament of the knee joint, capsule, and the ligament of the knee joint, and lower down we have this muscle that is called popliteus muscle, important muscle. So this is the floor of the popliteal fossa, popliteal surface of the femur, posterior ligament of the knee joint, and the popliteus muscle. It's important to know some information about the popliteus muscle because this is important muscle that its function is important for the knee joint. This triangular shaped muscle play a key role in the movements of the knee joint. It originates from the lateral surface of the lateral condyle of the femur by a rounded tendon and by a few fiber from the lateral semilunar cartilage يعني من الغضروف الهلالي البعيد. الانسيرشن قاعد نشوفه هنا descend down to be inserted to the tibia. The fibers pass downward and medially and are attached to the posterior surface of the tibia above the soleal line. This is the soleal line. Nerve supply, tibial nerve, and its action اعتيادي راح يكون الاكشن مالتها على هنا على التيبيا. يعني راح يكون عندنا medial rotation of the tibia on the femur, or if the foot is on the ground will be the lateral rotation of the femur on the tibia. راح يكون يعني عكس. What are the contents of the popliteal fossa? First, popliteal artery and vein, small saphenous vein, common peroneal and tibial nerves, posterior cutaneous nerve of the thigh, genicular branch of the obturator nerve, connective tissue, and within the connective tissue we have lymph nodes, popliteal lymph nodes. These are, in this figure we are exposing the content of the popliteal fossa. These are the boundaries, muscular boundaries, and this is the diamond shaped space, and these are the contents. We can see the popliteal artery, the popliteal vein, the tibial nerve, and the common peroneal nerve, and the small saphenous vein passing through the fossa to drain into the popliteal vein. First, we will study popliteal artery. Popliteal artery, here we can see this is a posterior view to the knee joint and thigh. Popliteal artery enters the popliteal fossa through the adductor hiatus خلال هذه الفتحة as a continuation of femoral artery. It ends يعني راح ينتهي عندنا at the level of the lower border of the popliteus muscle. هاي ليش قلنا هذه العضلة مهمة. At the lower border of the popliteus muscle by dividing into راح ينقسم عندي into anterior and posterior tibial arteries. What are the relations of the popliteal artery؟ راح يكون هو أعمق تقريبا أعمق structure موجود بالpopliteal fossa، راح يكون anteriorly here the popliteal surface of the femur، يعني يكون in direct contact. الارتري راح يكون in direct contact with the bone قريب على العظم. The knee joint and the popliteus muscle. These are the anterior relation. What are the posterior relation? Is the popliteal vein, tibial nerve, then fascia and the skin. Here we can see also this is the popliteal fossa. This is the popliteal artery here. It is related posteriorly to the popliteal vein, to the tibial nerve, and the skin and fascia. It will end, this artery will end at the lower border of popliteus muscle. What are the branches of the popliteal artery here in the popliteal fossa? It will give what we call, first we have muscular branches to the nearby muscle, and also it will give articular or what we call the genicular branches. These are the articular or genicular branches. What are also from the branches of the popliteal artery? These are the terminal branches of the popliteal artery. At the lower border of popliteus muscle, it will divide into anterior tibial artery and the posterior tibial artery. Anterior tibial and the posterior tibial at the lower border of the popliteus muscle. Now we come to an important item, which is the anastomosis around the knee joint. Why we have an anastomosis around the knee joint? To compensate for the narrowing of the popliteal artery, which occurs during extreme flexion. يعني خلال flexion of the knee joint، يعني خلال ثني مفصل الركبة. اعتيادي عندنا ال popliteal artery it will be kinked، يعني شلون راح ينثني. It will be kinked. اعتيادي راح يقل تجهيز الدم للليج. to compensate على مود نعوض هذا الشيء راح تكون عندنا هذه التفرعات من الشرايين around the knee joint. So to compensate for the narrowing of the popliteal artery which occurs during extreme flexion. هذه راح تكون هذه الانستموسيس is formed by branches above and below، يعني branches of the femoral artery, branches of the popliteal artery قلنا genicular branches، وكذلك من الانتيريور tibial والposterior tibial artery. Next, with the popliteal artery we have the popliteal vein. This is the popliteal vein running through the popliteal fossa. It is formed by the fusion of anterior tibial vein and the posterior tibial vein at the lower border of the popliteus muscle. It will ascend through popliteal fossa accompanied with the popliteal artery. So as it ascends through the fossa, it crosses behind the popliteal artery so that it comes to lie on its lateral side at first, passes through the opening, then more superiorly it will pass through the opening in the adductor magnus to become the femoral vein. يعني راح يستمر ويدخل بالادكتور هياتس وراح يكون its continuation will form the femoral vein. يعني نشوف هنا هذا هو femoral vein. هذا هو femoral vein is formed at the lower border of the popliteus muscle by the fusion of the anterior tibial and posterior tibial veins, and it accompanies the popliteal artery here, and it will ascend up, it will pass through adductor hiatus to become the femoral vein. Another content of the popliteal fossa is the small saphenous vein. The small saphenous vein perforates the deep fascia on the roof of the popliteal fossa. Here we can see it passing in between the two heads of this muscle اللي هنسميها gastrocnemius, two heads of gastrocnemius. هذا lateral head medial head of gastrocnemius. Perforate the deep fascia passing in between the two heads of the gastrocnemius muscle, and it will end in the popliteal vein. Another content of the popliteal fossa is the tibial and common peroneal nerve. مثل ما نعرف من المحاضرات السابقة أنه sciatic nerve at the lower 1/3 of the thigh, it will divide to its terminal branches. The medial one is the tibial nerve, and the lateral one is the common peroneal nerve in the popliteal fossa. Here we can see this is the tibial and this is the common peroneal. First, the tibial nerve. It arises in the lower third of the thigh, and it is the larger terminal branch of the sciatic. It is larger than the common peroneal. Tibial nerve here, we can see this is the tibial nerve, enters the posterior compartment of the leg by passing beneath the soleus muscle. هذه العضلة اللي نسميها السوليوس. إذن هذا التيبيال nerve راح يختفي من popliteal fossa, and it will pass below or beneath the soleus muscle to supply posterior compartment of the leg. Popliteal vein, هذا هو popliteal vein, will lie between the nerve and the artery throughout its course. يعني نشوف هنا بالpopliteal fossa شوف أنه الفين دائما يتوسط ما بين الارتري والنيرف. Popliteal vein lying in between the popliteal artery and tibial nerve throughout their course in the popliteal fossa. هذا الرسم يوضح لنا شلون أنه popliteal vein lying in between the tibial nerve and the popliteal artery throughout their course. What are the tibial nerve branches? طبعا راح ينطينا في muscular branches to this muscle nearby, to the muscle nearby. وينطينا في cutaneous branch that is called sural nerve. هذا هو sural nerve. This sural nerve will communicate with a branch that is called sural communicating branch, which is a branch from the common peroneal nerve. The sural nerve will descend down on the back of the leg, accompanied with the small saphenous vein, and then descend behind the lateral malleolus with the small saphenous vein to supply the lateral side of the foot and the lateral side of the little finger. So the tibial nerve will give cutaneous branch. We call it, this is the sural nerve, and it will give muscular branches. قاعد شفنا هذه muscular branches to supply the gastrocnemius, the plantaris, which is a small muscle, plantaris, and the soleus and popliteus muscle. And it gives an articular branch to supply the knee joint. The another branch, which is the common peroneal nerve. Common peroneal nerve هذا اللي هو باللون الأخضر هنا. This is the smaller terminal branch of the sciatic nerve, and it arises in the lower third of the thigh. It runs downward through the popliteal fossa, closely related to the medial border of the biceps muscle. هذه عندنا هي biceps muscle, and this is its medial border, and the common peroneal nerve will pass closely following the medial border of the biceps muscle. It will leave the fossa. شوف هنا خرج عندنا من ال popliteal fossa, and it will cross the superficial to the lateral head of the gastrocnemius muscle. هنا راح يكون عندنا النيرف superficial يعني شنو راح يكون subcutaneous and we can feel it by finger، راح يكون هنا superficial and it is liable for injury، راح يكون هنا معرض للإصابة. نشوف هنا هذا هو ال common peroneal nerve descending down behind the head of passes behind the head of the fibula then wind يعني راح it will wind laterally around the neck of the fibula behind the head around the neck of the fibula passing or piercing the peroneus longus muscle. هذه العضلة the nerve will pass through this or pierce this peroneus longus muscle and through this muscle as it passes through this muscle it will divide into two terminal branches اللي قاعد نشوفها هنا. هذا هو ال superficial peroneal nerve واكو عندنا الانتيريور اللي هو الانتيريور او الديب peroneal nerve. طبعا هذا superficial peroneal nerve راح يروح للlateral compartment of the leg و الديب peroneal nerve it will supply the interior compartment of the leg. Now, as we said before, the common peroneal nerve when it's superficial, past superficial, just below the skin, behind the head of the fibula, around the neck of the fibula, it is liable for injury. بسبب قرب على الhead والneck of fibula, if there is a fracture of fibula or broken fibula, it will cause damage to the peroneal nerve. That is all about the medial compartment of the thigh and the popliteal fossa and its content. Thank you.